Hi, everyone, and welcome back to the Nontraditional Nurse Podcast. Today, I'm joined by Tracy. Thanks so much for coming today, Tracy.
Thank you for having me.
So, today we're actually diving into a career path that I think many nurses probably don't even know exists: medical malpractice consulting. So, Tracy's built an incredible career in risk management, quality, patient safety, and she's here to explain to us how she made that leap from bedside nursing to consulting and what opportunities might be out there for nurses in this space. So, Tracy, you have had an impressive career in several non traditional roles. Could you walk us through your career path and how you made that transition from bedside nursing?
Sure. I started out as a bedside nurse in a rural community hospital in eastern North Carolina. It was only 147 beds, so it's fairly small. My clinical focus areas were CCU, PCU, and then I transitioned later in my career to perioperative care for the last 8 years. And during that time, I was one of two nurses in the OR, which administered the moderate sedation for our hospital. And I really enjoyed that part of my clinical experience. I was part of a quality improvement Duke Endowment grant position when I worked in the OR, and that actually focused on outpatient programs that reduced readmissions. So that was kind of where I stepped just a little into the quality realm of nursing with that position. And by that time in my career, I'd been in the acute care setting for about 17 years. And one day out of the blue, a friend of mine called me and she said, "Do you want to be a risk consultant for a malpractice company out of Raleigh, North Carolina?" Now, I didn't know much about risk management, uh, but by that time, my kids were older. They were pretty self sufficient. And I thought, well, why not take a leap of faith? And so I left the hospital setting and began my risk consulting career with a medical malpractice company out of Raleigh, North Carolina. And historically, when acute care nurses think about risk management, we think about the person who comes and visits us when a patient harm event has occurred and they want to interview us and try to find out what happened and why it happened. And that was pretty much my experience as well. So that's kind of how I got started in the risk consulting world. It was just a phone call one day from a friend and a huge leap of faith. And I'm very, very thankful that I took that opportunity.
Yeah, it's so funny how sometimes you have to knock on the door for an opportunity and sometimes it knocks on your door. But yeah, sounds like it was such a good way to get the door open. And then it's amazing what can happen when you take that first leap of faith.
Right.
So, for those of us that are not as familiar with medical malpractice consulting, can you talk about what it is, what a medical malpractice team might look like, and how nurses can contribute to that field?
Sure. So, medical professional liability insurance coverage protects healthcare providers from financial losses if they're accused of causing patient harm through errors, omissions, or negligence while providing medical care. Now, that can be anyone from a nurse practitioner practicing in a patient care setting in the ambulatory side and a physician practice clinic. It can be hospitals, it can be physicians, PAs, anyone that's providing medical care really has to have medical professional liability insurance coverage. Um, and then risk consultants typically serve as the clinical legal arm of the company, and we work closely to identify, analyze, and prioritize the risks. And we help develop mitigation strategies, support implementation, and sometimes we monitor the sustainability of the plan with the people that we insure. Sometimes, if it's a large health system, they have a risk management department. If it's a smaller organization or a private physician practice, they may not have those resources and they want to partner with us to kind of help them walk through beginning to end and close the loop and reduce that overall risk. Now, this can be achieved through conducting risk assessments, which is one of the main things that we do. We do focus on enterprise risk, because clinical risk isn't the only area where organizational exposure exists. We look at operations, we look at strategy, technology, finance, compliance, law, and we also do look at human capital on the human resource side. Now, we also work with underwriting and claims consistently. Underwriters may call us and say, this organization has applied for insurance coverage and these are the services that they offer. What are your thoughts about the risks based on the application? And from there, we do some research and we provide feedback to underwriting and we help them better understand the risk and make the best financial decision for the insurance company and for the applicant. And then that sets a premium for that risk. So you can kind of think about it like your car insurance. If you drive a Corvette, your insurance is likely going to be higher because it would be more expensive to fix it if it was damaged. On the healthcare side, an obstetrician and gynecologist premium likely is going to be higher than a general medicine practitioner's because the losses are going to be higher for the most part, if a patient is harmed. When you have maternal child birth injuries, that's certainly going to be much more severe than a different kind of non-specialty claim. And that takes me to the claims side. We collaborate with claims to determine if there are trends where we can offer targeted services to the insured. Maybe we do need to go out and conduct a risk assessment and better understand primary and other associated risks with the organization. One thing we know in healthcare is that one thing does not cause patient harm, but it's a myriad of things, and kind of looking at that Swiss cheese model,
Sure.
when patient harm occurs. And so, other risk services that are typically offered by malpractice carriers, where the consultants are involved or have input, we provide webinars to educate the insured, or we may do a national webinar where we invite lots and lots of different types of people. So we can talk about the trends that we observe in our claims data. Some carriers have teams that write articles or on topics such as informed consent, or some carriers even take it further and provide risk tips that may include risk mitigation strategies for specific issues, toolkits for high severity claims like those maternal child injuries. Every carrier is a little different in the services they provide from their risk team, but overall, the risk department in the insurance world is to really mitigate those losses for the carrier and partner with the insured to improve patient safety and quality and reduce risk. Most of the time, the consultants are remote workers and we travel and are assigned a region or a territory based on the size of the insurance carrier and the types of insurance that they provide. And I think the nurses can contribute to the field by really getting involved in their nuclear organizations and understanding the contributing factors to preventable patient harm, and partnering with those organizational leaders to find solutions at the unit level to mitigate and prevent future harm and put those things in place. You know, Doing a risk assessment at the unit level is certainly a tool that we would encourage and recommend to clients to help them implement best practices in their organization. And if organizations, did take those unit-based risk assessments and the findings and use those to drive improvements at the local level, undoubtedly that's going to benefit all stakeholders, right?
Absolutely.
The patients, the organization, and the malpractice carrier, which then takes you back to thinking about the premium. If you can show over time your risk reduction and improve your risk profile, your premiums are going to be less, right?
Yeah.
So it really is one of those financial things that organizations can look at from a cost savings perspective. Risk assessment itself doesn't reduce claims. It's the follow through that drives the reduction. So that's where we, as the consultants, do follow up with the people that we insure and make sure that they don't have any additional questions or concerns or tools or resources that they might need to get them to the next level. Because many times we just don't see the hardwiring of the improvement. And that can be due to lots of different variables like staff turnover or reprioritization of resources, within the organization. And so, really, on our side, on the insurance side of things, it is really important for us to continue that improvement and the hardwiring of that.
Yeah, that makes a lot of sense that obviously once you know about a problem, that's helpful, but it doesn't actually move the needle on changing the problem or the outcome. So, and thank you for that analogy with car insurance. Very helpful. So it really sounds like you are wearing a lot of hats when you work in this field. So could you walk us through what a day to day might look like as a medical malpractice consultant?
Sure. My day is never the same twice. Variation is something I enjoy, and I think that was one of the things that has kept me in the consulting space for so long. I enjoy doing something new each and every day. I might receive a call from a physician seeking guidance on patient discharge or how long do I have to keep medical records? What are the laws for practice with a collaborative practice agreement for an APRN or PA in my state? Or how do I handle an unhappy patient or family? Alternatively, at the same time or the same day, I could be coordinating continuing medication education or nursing education for the folks that are insured by the company or traveling to conduct a risk assessment. And sometimes all of those can occur in the same day. Most of the day is research involved, project work, or any or all of those things. So it's never the same twice.
You have to kind of be the expert on a lot of different things, so that makes sense. What would you say are some of the most common risk areas or safety issues that you see or work on?
In the acute care setting, medication errors, which are the most frequent, communication errors or communication failures, they are a major driver of claims and adverse events and outcomes, and diagnostic errors, which are high cost and high severity. In provider clinics, diagnostic errors are the most common. Others include tracking or management failures of testing. When a provider orders a test, they are actually responsible for the tracking of that test until the results have been communicated to the patient, whether that is via a staff member calling the patient with those test results or via the patient portal and making sure that the patient has actually seen those test results. And then, of course, medication errors, procedural complications, informed consent, and of course, again, those communication failures in provider clinics.
Thank you. Yeah, that makes a lot of sense, and I think that's something I don't think is well understood that you, as a provider ordering those labs, even if it's in like an urgent care setting, correct? When you just see that patient once, it's still your responsibility to follow up with that. So very interesting. Um,
Absolutely.
what nursing skills that you gained during your bedside experience do you feel like ended up translating really well into your risk management and consulting work?
So I think the big thing is, clinical assessment and critical thinking as a nursing skill. We're rapidly evaluating patient conditions and identifying subtle changes and deciding on interventions, right? It's the
Uh-huh.
nursing process. In risk consulting, we are analyzing organizational processes for vulnerabilities. We're spotting early warning signs of systemic problems and recommending preventative measures. So I think it's it really is just a different way of looking things from taking it from a micro level to a macro level, and really better understanding how we can then target the tools and resources down to the micro level to, prevent future harm.
Yeah.
With prioritization and triage, as a nursing skill, we're managing multiple patients at a time and allocating appropriate resources. And on the risk consulting side, we use risk matrices to rank issues by severity and frequency, focusing resources on the highest liability or highest patient safety threat areas and looking at those first. From a communication and coordination perspective, with a nursing skill, we do handoff reports, patient education, we participate in interdisciplinary team communication. And in risk consulting, we offer leading debriefs after incidents. We assist with staff training if the organization would like for us to do that. We facilitate communication between clinical teams and legal counsel and claims teams, not only within the company, but sometimes it depends on the organization. They might want us to be part of their team on a maybe a quarterly basis or something of the like. And then documentation and compliance. Obviously, as a nursing skill, we have to provide accurate and timely charting. And then in the risk consulting space, we audit medical records for completeness and compliance in accordance with policy and regulation and identify gaps that would potentially increase the organizational risk. So, when you think about it, it's not that different. It's just a different way of looking at uh, the intent of what you're doing. When you're in an organization, you're focused on the patient. When you work in insurance, you have to look at the bigger picture and all of the facets that ensure patient safety.
Yeah, absolutely. And that's one of my favorite questions to talk about because it really can help you reframe. You did such a nice job of, we learn all these skills. And I think nurses don't always give themselves enough credit for the things that we learn at the bedside and use every day. And those are the skills that if you were applying to a role like this, make sure you're highlighting them and giving outcomes of what you've done and talk about, your dedication to detail and your charting. And yeah, pinpointing those things when you feel like it's a foreign world, you really do have a lot of experience that would translate so well. So thank you for bringing that up.
Sure.
And what level of nursing experience do you think is really ideal for transitioning into a role like this? Or is there education needed or extra training? Or really, if you were thinking about transitioning, what do you feel would prepare you well?
I don't think there's a set amount of time, but I would say clinical experience in healthcare of some specialty is a must to gain buy-in from those with whom you'd be working. Now, that could be in the acute care setting or the ambulatory care setting. There are times when a carrier may be working on a specific program type, for example, maternal child health specialty things, and they need someone with that experience, and they might send out a solicitation to provide the subject matter expert input for that project. Just know that consultants spend between 25 and 50% of their time traveling, depending upon the expectation of the carrier and the client needs. But, over the course of 17 years doing this type of work, I've worked with people who were respiratory therapists, and maybe had a law degree. I've worked with nurses who had law degrees. I've worked with just clinical nurses that only had a bachelor's or a master's in nursing. So I think that the field is open enough that you don't have to be so specific in order to get this type of job because everybody brings something different and unique to the table. I actually worked with a nurse in my last role who was a lab technician when she started out. And so she has a lot of knowledge in that space. But then she went back later and got a master's in nursing. So she has a lot of very different knowledge that she brings to the table. So I don't think it's one role that gets you into this type of consulting.
Yeah, that makes so much sense because when you're looking at the Swiss cheese model, as you brought up, having a perspective from each level of care is huge because you want to know what the lab tech was thinking, when this happened as well. So very, very interesting. So if we're talking about a nurse who might be working at the bedside, kind of curious about this type of role, but really doesn't have any idea where to begin, what advice would you give to them right now?
So understand what the work really is. Many times it's about the bigger picture. It's about systems design, it's about policies and data. And, as artificial intelligence becomes more um, ingrained and evolves into the things that we do day to day, we really have to be more diligent about ensuring patient safety and reducing risk in the workplace. It's more about preventing harm and litigation versus reacting to events that have already occurred. I would say do a Google search about the companies and associations that publish information on risk management. The American Society for Healthcare Risk Management, or ASHRM, is a good place to start. And if possible, attend a national conference to learn more. Several states have chapters and offer conferences that are more finance friendly. ECRI is another good organization. You can search for medical malpractice carriers within the United States and get a list of those. And you can browse through their sites and see what requirements are necessary for open positions. Many are going to require a professional certification like a certified professional in healthcare risk management or CPHRM within a specific time frame of hire, but that's certainly doable within 12 to 18 months after you've been on the job and kind of gotten a bigger picture of how this works. If you're still in the acute care setting, ask if you can shadow the hospital risk manager. Nowadays, many of the carriers are going to want someone who has had exposure in risk or quality, patient safety, because they do understand the bigger picture from the beginning of a claim to the end after a patient harm event has occurred. And if the opportunity arises in your organization to transition to the department, take the chance. It will give you a taste of part of the process. And I would give every nurse the same advice that I gave my kids growing up. Take every opportunity that you can to learn and grow. Healthcare is changing at breakneck speed, and nurses have to have a seat at every table to ensure that we can provide the safest care with the least amount of risk to us and to our patients.
Yeah, I completely agree. First of all, in taking the leap, I think every non-traditional nurse that is just thriving that I've spoken with says it came from that leap of faith at one point or another, and it just went from there. So I think that's great advice. And also, I absolutely agree. Nurses are such an integral part of the healthcare system. I do think they should be at every table and with these discussions. So, where do you see opportunities for nurses to have a bigger voice when we're talking about patient safety or system level kind of decision making?
The first thing would be get involved in your organization by requesting to serve on committees such as patient safety or quality improvement, your policy and procedure committees. These are excellent places to start. And these committees feed directly into leadership's safety priorities and operational changes. And nurses who speak up here are going to help shape hospital policy. Number two, seek out risk and patient safety and quality roles. They directly influence system practices and reduce harm before it happens. And the third thing would be attend those state or national conferences like ASHRM or NAHQ or IHI Patient Safety Congress and explore the latest developments and network with the vendors who are there promoting their products and services. You never know who you'll meet. And Some of these associations do provide scholarship opportunities to first time people or people who work in certain types of settings. So always look and see if there are scholarship opportunities to help offset the cost when you're doing that.
Yeah, I didn't even realize there were scholarship opportunities, so that's great because I know when you're looking at the whole scheme of things, it adds up quick when you wanna add a certification, attend a conference, and I know for me, I would a lot of times tap into, like, tuition reimbursement for some of those certifications, so definitely look if your current provider is allowing you to do that as well. And I'll make sure to link all those awesome resources as well so people can find more information. Now, kind of wrapping things up, looking back on your career, is there anything you wish you had known before making that first non traditional career move?
I wish I had known how much I would miss the day to day camaraderie with my hospital team. It is something that you do have to work through. And like I said earlier, it took me about a year to transition from someone who was in a very fast paced hospital environment, hair on fire running down the hall, to working at home where it's just me and my computer siloed. So there is a difference in the mental aspect of things. But as time went on, certainly, I learned how to deal with that. Because it as in many units they become your second family. So it was kind of like shedding a family member,
Yeah.
and that you didn't see them anymore and you didn't necessarily do things with them anymore because you have different priorities and different needs. So when you're a consultant, many times it's remote, you're home or traveling or you're on a WebEx of some kind. But having said that, the number of people that I have met across the US in 17 years working for three of the major malpractice carriers has filled that void exponentially. I've made so many friends across the country. They've inspired me with their innovative ways of ensuring patient safety within the workplace. And it's a different way of life, but one that offers autonomy and work life balance and the ability to be part of the bigger picture of prevention.
I'm so glad you brought that up because that is such a true thing that I think is often overlooked. Remote work sounds so enticing, but when you really step back and look at it, most people that do work, at the bedside in a hospital setting, some of their best friends work alongside them. So that was a big transition for me, to working on an island. You feel like sometimes, like, oh, does anyone know I'm here? So I'm really glad you brought that up because that is a big part of it. And that transition period can be tough. So you kind of have to find what works for you. Well, Tracy, thank you so much for sharing your story and your insights with us today.
I appreciate you having me, and I can't wait to see what the next generation of healthcare workers bring to the table because I know it's going to be something great.
Absolutely. And I know this conversation really has the potential to inspire nurses who enjoy the safety, risk management type stuff in their unit and see that there is like so much beyond that as well. So if you enjoyed this episode, be sure to subscribe, share it with your nurse friends, and check out the Nontraditional Nurse for more interviews and resources to help you explore your own career possibilities. Thanks again, Tracy.
Thank you, Ellie. Have a great afternoon.